tonight we have a special guest with us. His name is Dr. Jeffrey Teckman, and Jeff is a professor of pediatrics, that's kids, and biochemistry and molecular biology at St. Louis University, and of course at the School of Medicine there, and he's also a clinical resource center physician. Dr. Teckman is probably one of the best informed people I know, certainly on Alpha-1 liver disease, and I think we're pretty lucky to have him. He's going to speak mostly about research, but I just want to let people know that as we're doing tonight, we do record these meetings, and we had another one with him a while back on basically just on pediatric Alpha-1 liver disease, and it's on our website if you want to listen to it. Obviously, you can't ask questions at that point, but you might want to have a look at that as well. So the format tonight is Dr. Teckman's going to talk for about half an hour, and then we have half an hour set aside for a question and answer session. If anybody's got any questions about Alpha-1 Canada or anything else, I'd be happy to stay on the line after the meeting's over and the recording stops and talk to people that way. So thank you very much for being here, Dr. Teckman, and the floor is yours.
Well, thanks for having me. Welcome, everybody. I hope there are a lot of people there. It's always interesting talking to a conference call when you don't really know who's there. But, yeah, I thought I would just sort of give some general overview, talk about some new developments, and then take questions. If you want to just have a pad of paper nearby, and, if I say something and sparks a question, jot it down, and we cover it at the end. If we were all together in a room, I wouldn't mind interrupting, but it's hard on the conference call. I can't see if your hand is up. So just jot things down. I think, again, let me just kind of start with some general information. So, because people always talk about your liver, and then everyone nods their head, oh, liver, yeah, liver. But I think maybe we don't know as much about the liver as maybe we think we do. Your liver, lives in your upper right-hand part of your abdomen, and your liver does many different jobs for you. It makes part of your blood, including alpha-1 antitrypsin. Your liver helps you digest food. Your liver removes waste products from your body. When you eat, all the nutrients in the food you eat, plus toxins, all food, all plants, animals, vegetables, anything you eat, or medicines you take, have molecules in them that are toxic and molecules in them that are beneficial. And all the blood from your stomach and intestines picks up all the food and nutrients and energy and fats and proteins, and all that blood goes to the liver. That's the next stop in your body, is the liver. And the liver is then responsible for processing all those nutrients, remove the toxins. Sometimes it stores things, sometimes it sends things on to the rest of your body. So your liver is doing a lot of different things. And unlike your heart, you feel your heart beating or, you're breathing, you're not really aware of your liver working. And that's true whether it's working fine or even if it gets sick. So sometimes the liver can get very, very sick, and people have minimal symptoms until it's very far advanced. And so your liver does a lot of different things. And, in fact, one or two of the things the liver's doing can go wrong, but the rest of the liver jobs keep on going. So to understand what's going on with the liver, you need multiple ways to evaluate the liver. When a doctor's checking a patient's liver, you ask a lot about any symptoms, fatigue or itchiness or sleepiness or a lot of other diarrhea, weight loss. A lot of things that sort of are general symptoms doctors ask about anyway, but that might be symptoms of liver problems. And then the physical exam, performed very carefully, tells you about the liver. But then, we need a whole variety of blood tests, x-rays, biopsies, ultrasounds to understand what's going on with the liver. There isn't one liver blood test that really tells you, about the liver, not one scan that tells you about the liver. So in alpha-1 antitrypsin deficiency, I think most of you know, ordinarily your liver makes huge amounts of alpha-1 antitrypsin. Alpha-1 antitrypsin is a protein. It's made in the liver and released into the blood in very large quantities. And if your ZZ for alpha-1, which is sort of the most common scenario and the one we'll talk about mostly tonight, although we can talk about other things in the question period if you like, but just for simplicity for the moment, if your ZZ for alpha-1, your liver is still making huge amounts of alpha-1 antitrypsin, but it's making the Z kind, which is abnormal. And the liver, even while it's manufacturing this Z alpha-1 antitrypsin, the liver recognizes that it's making something that's wrong. And so it doesn't release it into the blood. So blood levels are too low. Hence the name alpha-1 antitrypsin deficiency. It's a blood deficiency. But the liver has too much. So the Z builds up in the liver. Now the liver tries to recycle it by breaking down the Z alpha-1 antitrypsin into the building blocks and recycling. But for reasons we don't quite understand, some of the Z alpha-1 antitrypsin doesn't get fully recycled, and it builds up in the liver. And over time, that damages the liver. So the lung in alpha-1 is vulnerable to damage because you don't have enough alpha-1 in the blood, but the liver gets hurt because there's too much. The other thing people talk about with regard to the liver is liver fibrosis or liver cirrhosis. Again, it's another thing people say, oh, liver cirrhosis, but then, what exactly is that? We're not always quite sure. Well, imagine that you cut your skin, and when it heals, you might have a little white line, little scar there. Well, that happens in the liver. So if the liver is slightly hurt, it gets a little scar tissue in the liver. But if the liver gets hurt repeatedly, just like if you cut your skin the same place repeatedly, then a bigger scar builds up. And that's what happens in alpha-1 antitrypsin deficiency. This year after year buildup of the Z alpha-1 in the liver damages the liver repeatedly, and over time, scar tissue can develop, and that's liver fibrosis. And if the scar tissue gets extreme, that's cirrhosis. Now, so what? So what does that mean? Well, that means that all that blood coming from your stomach and intestines, it has to pass through the liver on the way to the rest of your body. If your liver has a lot of scar tissue in it, that blood can't get through. So it's like a partially clogged drain. Like if your kitchen sink gets partly blocked and the water is sort of just standing there but maybe going down really slowly. So that's what happens in the liver. The blood cannot get through if you have cirrhosis. And it causes a backup in the rest of the blood vessels in the abdomen. And that can lead to bleeding. It can lead to buildup of fluid in the abdomen. It can lead to toxins reaching your brain, which aren't supposed to get there, and people can go into a coma. Lots of bad things can happen. So that's really what cirrhosis of the liver is. So how do we treat that? Well, as I think you heard, I'm a physician and a pediatrician by training, although I've been doing research on alpha-1 antitrypsin deficiency, adult and pediatric, for 20 years. And so we spent a lot of time, thinking about some of these questions. What happens in the liver with alpha-1? How do you stop it? And in fact, we have a number of liver treatments that we use for people in general. So if your liver isn't digesting food well, maybe you're not absorbing certain vitamins, we give extra vitamins, or we give extra nutrients. If your liver isn't making what it's supposed to make and dumping it into your blood, then we can replace that in your blood. If your liver is having other problems with toxins or something, there's treatments we can give there. But there's nothing specific for alpha-1 antitrypsin liver disease. Those are just things we give to anyone with any liver disease. Unfortunately, we don't have, a treatment for alpha-1 for the liver. Now, for the lung disease, there is the protein replacement. But since the liver disease isn't caused by a lack of the protein, giving the protein replacement into your blood has no effect on the liver disease. We've been struggling for a long time with, how do we treat the liver, and what do we think we can do? So the next question is always, who gets sick? And I think in the Alpha-1 community, we make the mistake of talking about, I'm lung affected, I'm liver affected. Really, everyone has the potential to have a wide variety of health problems from alpha antitrypsin deficiency. And just because you have lung disease doesn't mean you're protected from liver disease. Just because you have liver disease doesn't mean you're not going to get lung disease. What this concept comes from is the age at which people get sick. So what I mean by that is when a ZZ baby is first born, there's maybe 20% of those children that are sick right at birth. And they're sick with liver problems, not with lung problems. And the risk of life-threatening liver damage in children with Alpha-1 is about 5%. So, that's 5% too high, but it's not terribly high, right? And then it turns out that if you don't die of liver disease as a small child, a lot of times your liver problems go away. And so in people who are 20 years old or 30 years old, almost all of them, their livers are working fine. Occasionally there's a rare person whose liver gets sick, but in those young adult years, the liver in Alpha-1 tends to be working fine. However, that's when people tend to smoke or have other problems, and so the lung disease tends to get diagnosed in people who are in their 30s or 40s. And so, those are people who either did not develop liver disease in childhood, or it was so mild it was never diagnosed. And so and then they end up seeing an adult lung doctor when they're 45, and they see themselves as lung affected, even though we don't really know what their liver was like as a child. And then, as it turns out, the longer you live with Alpha-1, the greater your risk of liver disease. So we don't know exactly the answer to these questions, and this is one of the problems we've got. People ask me, well, what's my chance of getting, cirrhosis of the liver? This was my blood test. What does that mean for 5 years from now? We don't really know that very well. But the best evidence we have would say that the lifetime risk of serious liver damage like cirrhosis is probably 50%. So that's pretty high. And usually that's older adults, so people in their 50s, 60s, 70s. And in fact, one way of looking at this has been that, before there was protein replacement, there were people who probably would not have lived into their 60s, who then, when they get on the protein replacement, they stabilize and do well from the lung standpoint, but then they live long enough to get liver disease. So liver disease is an increasing concern for our community, and as I said, since we don't have a treatment and we don't know how to predict which 50% of people very well are going to get sick, this is becoming a priority. So how are we addressing this priority? That's your next question. Then, of course, is great. This guy can talk, but what are you going to do for me now? So we're doing several things. First, and that's the community, physicians, patients, all of us, families, we need to just know more. We need to try to predict, who gets sick as a child, why these 5% of children get so sick, why certain people, when they get to be 60, get cirrhosis and other people don't. Why is that? So we're doing two things to look at that. One is what's called the Childhood Liver Disease Research and Education Network, or the Children Study. Yeah, fancy little acronym. Took a long time to think that one up. So the Children Study involves 15 centers in North America, including Toronto, and it's 15 children's hospitals, and what we do is we follow several hundred ZZ children, and we see them every year, and we keep very, very careful track of all their medical events. So, what their blood tests show, what their ultrasounds show, how tall they are, if they have other diseases, do they have asthma, do they have allergies, what medicines they're on. We keep track of a huge amount of information. And we also collect their blood, we collect their DNA, and it's stored in a huge database. And we've been doing this since 2007. And we are just now starting to get super results from this study. And in fact, it's called the Children Network, but actually enrolls anyone up to age 25 who's either ZZ or SZ. So it's age 0 to 25. And it has formed a tremendous basis to understand why this group of children gets so sick and helping us figure out what we might do to treat them. As yet, we don't have a treatment, but we do have several researchers and several drug companies who are getting involved in the study and talking to us about what we can do next and how we can improve the health of these kids. So, there is a website, childrennetwork.org, or send me an email and I'll hook you up. If you know anyone, if you want to give information, or you have information, you have questions, or you know someone that might qualify, we really, really think this is a great thing to be involved in. It's going to answer, it has already and is going to in the near future answer so many more questions about liver disease in kids. So, what about adults? Well, we know even less about the adult liver disease. There have been a number of studies of children with liver problems with Alpha-1, but there's been so little information. The only real information we have, it comes from Sweden. It comes from studies of people that passed away in Sweden with Alpha-1. And, once someone has passed away, once you collect information from people who have died, it's just hard to get good information. You can talk to their family, you can look at their medical record, but we really need to collect information before people get so sick. We need to collect information when people are well or maybe only a little sick and try to stop it so we can make them better and stabilize them. And so the Alpha-1 Foundation has spent a lot of money in the last couple of years to start up an adult liver study, which we're now starting. And it has several phases, and I won't go into a lot of it, but the first phase is for us to follow a group of we're actually following the same model as the children's study because it's been so successful. And it's also a model which other adult liver diseases have used to really understand and bring new treatments forward for many adult liver diseases. So what we do is we have a group of patients, and again, they come in once a year where they get blood tests, ultrasounds, breathing tests. We collect a lot of information about diet, about their family, the environment, smoking, alcohol intake, occupation, all kinds of information. And again, we put all this into a huge database, and we follow the patients every year for 5 years. And at the beginning, first visit, people have special scans of their liver and a liver biopsy, and then they have non-invasive evaluation each year. And then at the end, we repeat all the things we did at the beginning. So if you remember from high school geometry, 2 points determine a line, right? So a lot of times we'll see a person, and they'll say, oh, doc, my scan showed this amount of damage, or my blood test was this, or my biopsy was this. There's a little damage there. Is it going to get worse? And we don't know. That's how we're going to answer that question, because we're going to see over these 5 years if you have a certain amount of damage, does it not change? Does it get worse? Does it get better? And what factors in your lifestyle or in your medical history seem to predict that, so we can tell people what to do to stay healthy. We're also doing lots of special biochemistry on the patient's blood and their DNA in labs all around the country to get some really, really important information. At the moment, we just started enrolling just this summer for that study. We are enrolling patients in St. Louis, and we're enrolling patients in San Diego, California. And soon we'll have a site on the East Coast of the U.S. Unfortunately, I don't have a Canadian site yet. We're getting up and running, but these are long-term plans, and we need more funds and to write more grants to get support. But we have support to start and to enroll enough patients to answer some good questions here at the beginning. There's also a study that some of you might have heard of in Pittsburgh, and Pittsburgh's the only site, and it's for people with very severe liver damage, so people who really would pretty much be on liver transplant lists. And that's the study of medication, which was found to have some benefit in animals, but which we don't know if it helps people yet. The animal dose was very, very high. The animal dose that helped the liver disease was 10 times the normal dose. They're not giving the humans 10 times normal dose. They're giving the normal dose. So it's not clear if this dose is going to help people, but if people have very, very sick liver and they're interested in traveling to Pittsburgh for a very extensive evaluation and following, then that's an option. And again, I can put people in touch with the right people there. Speaking of testing in animals, this is my last wrap up, and then we'll do some questions. So, there's been a lot of scientific work done on alpha-1 antitrypsin, lung and liver, in the last couple decades. And interestingly, we have this mouse, we have this breed of mice that gets alpha-1 liver disease. And we use these mice to study how the liver gets hurt. We also use the mice to study how to block the liver damage, how to heal it, how to cure it. So in the last few years, between researchers in my lab and in other institutions all around the country, we've got about 6 different ways to cure the alpha-1 mouse of liver disease. We can fix the mouse. Now, that's not the same as fixing a person, but it's getting pretty close, and we're really, really excited. So we have 6 different drugs which have used in different ways or different treatments can fix the liver disease. And are you still there? I lost me for a second. We're getting really, really close to fixing the liver disease in people. But what we need is we need drug companies and patients and doctors to all get together to work on it, because the drug companies are who we need now to put a lot of money into these drugs to move them from an animal to a human trial. And the drug companies, in North America, we have for-profit drug companies, and they do a calculation. They say, well, if I'm going to put $10 million into getting this drug approved from a mouse to a person, how fast am I going to earn my $10 million back in sales? And in order to figure that out, they need to know, well, how many patients are going to be on this medicine? How much can I charge? How long are they going to take it? And these are some of the questions that our studies are going to answer, because we don't have these answers now. The drug companies will sometimes contact me, and they'll say, well, we have this candidate drug, and, how many of these alpha patients, are this amount of sick, and how many are going to get sick in a year? And, we don't have that. So both the children's study and this adult liver study are generating information which is essential to convince the drug companies to spend money on alpha-1 cures. And the drug companies are getting involved in these studies. They're supporting of them. They're really watching them incredibly carefully. And we have to carry them through, because it's in a rare disease, it's not going to happen if we don't really get a lot of information. It's so exciting. We're so close. We just need to push a little harder. We're just the last slope to get over the mountain here, and to transfer some of these cures from the mouse lab to the bedside for people. So we're really excited, but we have a little more work to do. And if we really get behind what we're doing, I think we can make it. So I hope everybody's still there. That's my shot. Why don't we take questions, or let me know if I'm sounding crazy.
No, I think we're all still here. If anybody wants to ask questions, just sort of speak up, because I got a bunch that I'm going to say so we end.
When will they start testing all babies?
Right. So very controversial. So I think what you're asking about is newborn screening.
Yes.
Right. So when a baby's born in either North America and Western Europe and
yes.
Australia, when a baby's born, they prick the heel and get some drops of blood and test the baby for a number of diseases. And depending on the country you live in, there's different kinds of diseases that are tested for. And usually the diseases that are tested for in newborns are things for which there is a treatment that helps the baby pretty much right away. Oh. And because it's costly to test every baby that's born for anything. And so again, the government and, and researchers and doctors make a calculation of how much money we're going to spend for testing versus what's the benefit's going to be, either benefit in health
right.
or benefit in money saving or something like that. And unfortunately, most of the things that are tested for, at least the more common things, are things for which there is a direct intervention. So, PKU or phenylketonuria is a diet which can save a baby from mental retardation, so that's important, and you can start the diet right away.
Yeah.
Sickle cell disease, which you can give treatments for to slow down some of the damage. There are other diseases where you can make an intervention. Unfortunately, since we don't have a treatment for Alpha-1 liver disease, and that's usually what affects newborns with Alpha-1, people, governments, states, provinces have been reluctant to spend the money on newborn screening for Alpha-1 when there's no surefire treatment. Now, many of us have argued that telling people not to smoke is, in fact, the intervention. And if you look at studies in Sweden from a number of decades ago, where they diagnosed a number of children at birth, when they diagnosed kids at birth, the rate of smoking in those kids when they became teenagers was 1/3 the level of Sweden in general. So there was a major effect on reducing smoking when children with Alpha-1 were diagnosed at birth. But that so far has not convinced either Canadian or U.S. Newborn screening authorities to accept Alpha-1. Now, there have been some very preliminary experiments. There was one a number of years ago in Oregon in the United States. There's one in Minnesota. There's presently a pilot study going on in New York State. But as of right now, it's in a holding pattern.
Yeah, if I could just add, we've basically been told that by the newborn screening agencies here in the various provinces in Ontario, in Canada. And of course, one of the issues is, as Dr. Teckman said, so we're going to tell parents that their children have Alpha-1 antitrypsin deficiency, and they're going to say, what can I do? And we're going to say, well, in 12 years, you can tell them not to smoke, but other than that, there's nothing we can do for you. It's a fairly stressful situation that governments are seeming to shy away from. But the other thing to keep in mind, too, is we don't have genetic non-discrimination legislation in Canada. So this testing is done. It goes into the child's medical file. They turn 25. They go to try to get an insurance policy, a life insurance policy, or a health insurance policy, and they're told, no, sorry, you've got a rare disease. We're not going to insure you. So it's a real conundrum in terms of newborn screening for Alpha-1. But sorry, I'll keep my...
No, that's exactly right. That's exactly right.
I've got a quick question, if I may. I'm a ZZ patient, obviously lung and liver. My liver seems to be deteriorating faster. And I know you don't have a cure and you probably can't answer anything, but is there any way of slowing it down? I don't drink, I don't smoke anymore. I try to exercise at the gym, 3-4 times a week. But is there anything dietary, vitamin-wise, anything that you could possibly slow it down? And then my second question would be, once I go from fibrosis, is it inevitable that it will be cirrhosis, and what can I expect?
Right. So, how to keep your liver healthy? Well, I think at the moment, we have just good health advice. So a lot of those things you said, eat a healthy diet. If people have no liver damage at all. So if you look at other adult liver diseases like hepatitis C virus infection, things like that, if people have hepatitis C virus infection but their liver has no damage, then some data suggest that they can drink up to 3 drinks per week without any health effect. If you do have liver damage, of course, we recommend no alcohol intake. Also, maintain a healthy weight. If you get fat, your liver gets fat. And just like your heart works harder if you're heavy, so does your liver. So, all the things you said, exercise regularly, all that stuff. There are various vitamins, herbs, supplements that are marketed for the liver, those things are probably as dangerous as they are helpful. And, you know, they have, most of those things have not been tested for safety. And if they haven't been tested in people with liver disease. They've been tested in healthy, normal people. So, you know, we tend not to recommend a handful of supplements from the supplement store. As tempting as that is, and as you know, as big as those signs are, liver cure, blah blah blah. You know, it's not. There's another thing that we found in the mice studying the Alpha-1 liver mice is that if you give the Alpha-1 liver mice ibuprofen type medicines, those are called NSAIDs, non-steroidal anti-inflammatory drugs. It's not good for them. The liver in Alpha-1 actually starts making more Alpha-1 if you give it a lot of NSAIDs. And since it's the buildup of the bad thing in the liver that hurts you, in the Alpha-1 mouse, if we give it a lot of Motrin, the liver gets worse. So does that mean a person with Alpha-1, if they take one Motrin, the liver's going to explode? Probably not. But, you know, I think it is a finding in the animal that's a toxicity. So, you know, tentatively, and there's no human data, obviously not ethical to round up some ZZ patients and give them Motrin and see what happens. That wouldn't be good. So, you know, really what we have is to say, you know, if I was ZZ and I had a headache, I'd take a Tylenol.
I don't take anything.
Right. Well, you know, Tylenol is harmful to your liver in overdose. Tylenol in normal doses is very well tolerated. So, you know, for an occasional headache, many of us suggest a Tylenol. Now, sometimes people say to me, well, I have a heart condition and my cardiologist told me to take a baby aspirin every day. You know, that's probably not a bad idea. And I certainly wouldn't wave anybody off of an aspirin for their liver because their heart doctor said to take it. I just mentioned it. You know, if you have a choice, the animal study would suggest avoid ibuprofen, or NSAID type medicines. That's, you know, ibuprofen, Aleve, aspirin, that class of medicine. Your second part is, hard for me to answer what to expect. This is why we're doing our adult liver study, because we don't know if you have a certain level of fibrosis in your liver. We don't know how quickly that goes to cirrhosis or how likely that is to go to cirrhosis. There are some people that have some fibrosis in their liver where they get a little bit and it never progresses. And there are some people who it progresses very rapidly. And that's what we have to know, because when we get these treatments ready to roll, we're going to want to focus them on the people that really need it. We're not going to want to just round up everybody and start giving them the liver cure. We're going to look for people whose livers are getting worse and try to stop it. And so that's why we need to do the pediatric study and the adult study, so we really understand how to identify these patients so we can intervene when the drug companies come through with these drugs. But, there are people who have cirrhosis who, live for decades and do very well. And again, that's something that we don't always understand. But it does happen, and they're following good health practices and whatnot. And I follow patients with cirrhosis who have normal liver blood tests. So it's one thing we didn't talk about with liver tests. There are these tests that ALT and AST, some people call them liver function tests. They actually don't measure any function of the liver. So why they were called that, I don't know. But I wasn't around then. It was before my time. But these are enzymes. These are chemicals found inside liver cells. And they leak out into the blood at a very slow rate, so blood levels should be low. If your liver cells are damaged, your AST, your ALT leak out into the blood at higher level, at a faster rate, and blood levels go up. So measuring your blood ALT is a rough measure of damage to your liver cells, but it's not absolute. There are people, as I said, who have cirrhosis, who have normal ALT, and there are people who have really no fibrosis, no damage at all, whose ALT is elevated. So again, this is something we need to understand, but sometimes people, I think, maybe get a false sense of security, or they say, oh, well, my doctor checked an ALT, it was normal, therefore I don't have liver disease. And that's probably, not really the thorough kind of checkup people need. Is one blood test. It's got to be more than that.
Mm-hmm. Okay, thank you very much.
Anybody else have any questions?
So if they test for your liver, I ask my doctor every 6 months to check my liver functions or whatever. If I want, can I ask for more extensive tests?
Sure. I mean, I think it's hard, for me to, advise any particular course of action. I think, as I've said before, evaluating the liver involves carefully asking patients about their symptoms. It involves a careful physical exam, and it involves, blood tests, X-rays, ultrasounds, sometimes biopsies,
I just
other
get
things.
Blood tests. So
right. I mean, it depends a lot on what those tests show, and what the physical exam is, and what else is going on. So, but certainly, people should have somebody paying attention to their liver. That's,
Well, I'll mention actually, just to help you out with that, a couple of years ago I ended up having a liver biopsy, and I found that very invasive. I've been in every bloody machine there is, and now what they do is they do a blood test and a fibroscan, and I find those non-invasive, but at least they give me the information that I need.
Right, and good to mention the fibroscan. So there's a lot of new technology with regard to monitoring the liver. FibroScan is a new technique which is only recently available, and as you say, it's something we're doing in the liver study. Everybody gets a FibroScan for free, and gets in our adult liver study, all the tests, the FibroScan, the X-rays, the ultrasounds, the blood tests, the patients get all that information.
See, and in Ontario they charge $80 per FibroScan.
Right. Well, if you just went to the doctor and got it, you're right, it would cost that. But in our study, where the study's paying for all that, so that the patients can benefit, and we can give it to them. It is a very. But what we really need is ultrasounds and the other evaluation and the FibroScan, and then we'll know better what it means going forward.
Right, and that's what my doctor's doing here in Ontario.
Dr. Teckman, did you say that childrennetwork.org or .net?
It's ChildrenNetwork, so it's two N's in there.
Right.
.org.
.org. Okay.
Yes, sir.
So I was just wondering, with that study, I mean, I know the children's hospitals in Canada, once a child, I guess, reaches the age of 18, they can't be treated there anymore. So do you lose those children in terms of the study, or? Well, I know you said they can stay until they're 25, but I don't think they could go, for example, to the kids' hospital at age 24. And
right. Well,
I'm not sure.
The study doesn't require you. Neither the children's study or the adult study, they don't require you to get your medical care at the point of the study. You could. So some of the children in the children's study, if they're a 10-year-old and their doctor happens to be at Sick Kids, and there's ZZ, they may go there for the medical care and be in the study. But there are children who get their care elsewhere who just go to Sick Kids to be in the study. And that's what happens to some people when they age out like that, is they would go once a year for the study visit, but it wouldn't be their regular doctor's appointment. And the same is true with our adult liver study. We're not necessarily taking over people's medical care. On the other hand, we are providing people with, a consultation with a world-famous liver doctor. At each of our sites, we have a world-famous liver doctor who is doing the consultations. It's not some trainee or resident or something. It's a person who's really, really accomplished in liver, really knows what's going on, and the patient gets a consultation with them and an evaluation and all the labs and everything from the study. And we've already had in our adult liver study, we've had 2 patients actually already have some benefit who, through the evaluation of the study, were found to have other health problems which could be treated and addressed, but which were not detected until they were in the study. And the same in the study in Pittsburgh I was telling you about. The first 2 patients that went for that study were found on the pre-evaluation to have liver cancer. They were asymptomatic, didn't know about it, and was caught early. It would have not been good if it had gone on. So, we're really trying to provide people with all the information they can, all the health information we can, and, to make it not only beneficial to the community at large to learn things, but beneficial to the individual, too.
Yeah, but excuse me. When I ended up getting my lung specialist and as well as my liver specialist here in Waterloo, I signed a piece of paper saying that they could use all my medical information and whatnot and send it to the Alpha Foundation, and I got paperwork for that too, where I gave them permission. So wouldn't you have access to that kind of information for your study as well?
Not necessarily. I mean, a lot of this has to do with how the information is collected. So there is, some collection like that, but to really get this down, for example, the physical exam needs to be performed in exactly the same way in every location, and the patients have to answer the same questionnaires. Like I say, we give them questionnaires about their diet.
So that information wouldn't be helpful to you.
Well, it's not that it's not helpful; it's just incomplete.
Right. Okay.
So to really get the maximum impact, we have to collect it in the same way everywhere, the same. In the same.
Right.
And I will mention too, as long as you brought that up, the adult liver study. So the pediatric liver study is paid for by the U.S. National Institutes of Health with some input from, as I said, from Sick Kids in Toronto. The adult liver study is paid for by the Alpha-1 Foundation, and all the information we're collecting is owned by the Alpha-1 Foundation. So,
right, okay.
The moment the information is in our database here in St. Louis as we study it and build it, but ultimately, I don't own the information. It's owned by the Alpha-1 Foundation and the patient community. And it is, as we go forward, will be linked to the Alpha-1 registry and things like that. So there's a lot going on behind the scenes to be sure we're not recreating the wheel here. This is, a study which is attached to our existing infrastructure.
Mm-hmm.
So are Canadians eligible then for the adult liver study?
They are. We do have some travel money. I'm not sure I can. Well, we'll become close. We're actually getting a little extra travel money, so I don't know if I could cover the entire cost from Canada to St. Louis, but I could come close probably.
But you said you are trying to establish a Canadian center, or?
We have to stay within our budget. Obviously, the world runs on a budget. So.
Good old politics.
Yeah, at the moment, anyone who's interested, send me an email. And, that's, of course, no obligation whatsoever. If people contact me and they get information and they decide they're not doing it, that's perfectly fine. We still like you, of course. But we do
want to help out the next generation. That's the point, right? I mean, if you have it in the mice already.
Yeah. I want to help this generation, too. I'm not giving up on this generation.
No, I know, but I mean, for people like me, I'm looking at the next generation. Looking at the grandkids, you name it, and by that time, you would hope that there is some kind of prolonging or some kind of cure.
Right, that's what we're hoping. So,
yeah,
if people want any information at all, please send me an email, and either I can talk to you or my nurse coordinator can talk to you, give you all the information, and we can talk to you about the travel money we have available and If it doesn't work out, it doesn't work out. If it does, then it would, of course, be great. But it's always better to give more information than less.
Any other questions? Theo, you don't have any questions?
1,000, a million questions, but no answer.
No, I don't have any. Maybe just one question. I was wondering about the Znull gene. Would that, if you had a liver disease, would your chances be better with the null gene?
Right. The people who are null don't get any liver disease. People that are Z-null would probably be at very low risk. In most cases, it really takes the double dose of Z to make people's liver sick. There are some SZ people who get liver disease, but I would think Z-null, MZ, those people very, very low risk of liver problems.
Okay.
But those people do have a high risk of lung problems if they smoke.
That's correct, even if they don't smoke, yeah.
Yeah.
Okay.
Well, I think I must have done it.
Well, okay, I think if there are no
Did you have another question you said, Jim?
No, I think I asked them. I am going to get in touch with you about something else, though, tomorrow. But I think we'll, on behalf of everybody, thank Dr. Teckman for his time. I know this isn't the ideal time of day for people who work all day as well, but thank you very much. And I just want to make sure everybody knows that if you want to review this, it should be on the website in a day or two. You can listen in. And again, thank you, Dr. Teckman. And if anybody wants to stay on the line to talk about other things, programs that Alpha-1 Canada has, or anything like that, feel free. I'll stick around for a few minutes, or at least, I guess, till everybody hangs up.
Okay, I got to go because I actually have another call. So.
Okay. All right.
Thank you.
It was great to talk to you. I'll talk to you again soon, maybe. Okay?
Okay, have a great night.
Okay, bye-bye.